Nursing home residents have been largely isolated for the last 6 months. Their family members say it is literally killing them. Since March, in-person indoor visitation was only allowed if a loved one was dying. Then in June, outdoor visits were allowed. But now that the weather is getting a little colder, indoor visits will finally be allowed. By Monday, the Department of Public Health will rescind a previously issued order and allow for indoor nursing home visits.
It's a major announcement.
It brings the state's rules in line with federal guidance from the Center for Medicaid Services.
It's absolutely a first step, and I think what it does is it opens doors for us to talk about this.
Liz Stern's mother is in a long-term care facility. While grateful, she says the order doesn't go far enough because touch is still restricted. A 30-minute visit with her mom lasted only 5 minutes because her mother was tired, and Liz wasn't allowed to be close to her.
I couldn't help but think that if I could be by her side, I could hold her hand and speak softly to her for 30 minutes. I couldn't.
The virus has waned in long-term care facilities, but public health data will always be monitored.
We're in a good spot right now, but that could change. No one wants it to, but as the state moves indoors.
The new guidance will also expand the definition of compassionate care beyond imminent death. Now residents can get a visit if they're just admitted and having trouble adjusting to new surroundings, grieving the loss of a loved one, need help or encouragement eating or drinking, or if they're experiencing emotional distress or depression. The new order also allows for resident welfare advocates called ombudsmen to re-enter facilities for the first time since March.
And we do in-person investigations of complaints. We talk to the residents directly. So we'll work on those first. And then they do quarterly non-complaint visits to get to all of the nursing homes.
For the last week of data available, only 12 new resident COVID infections were logged at Connecticut's 213 nursing homes. Although it's worth mentioning, 33 staff did test positive. Reporting for the Department of Public Health in Hartford, Matt Caron, Fox 61 News.